Hello, everyone, and welcome to SCORE Fairfield County's live webinar on how to avoid costly mistakes with Medicare. I'm Bob Hogan, the webinar coordinator today and a business mentor here at SCORE Fairfield County. I'll be your host today, and our presenter is Sheila O'Donnell. More on Sheila in just a minute, but first some brief information on SCORE. SCORE is a nonprofit national partner of the SVA with over 10,000 volunteers nationally. Locally here at SCORE Fairfield County, we have about 100 volunteers with a wide range of industry, process, and subject matter expertise. And we offer three primary value-added services to small business owners. First of all, we offer free one-on-one counseling, and you can access that in person, by video, telephone, email, whatever works best for you. And you can do that by clicking on the Request a Mentor link that you see on the screen. Sheila, if I could just ask you to advance the slide, please. Secondly, we offer a wide range of educational workshops and webinars like the one today. And lastly, we offer extensive resources on our website, including access to subject matter experts. Our next live webinar will be tomorrow, May the 21st at noon, when Cliff Enico will be presenting Selling on Amazon and other platforms. Look for specifics on our website, fairfieldcounty.score.org. And if you're on our website, we also have a large number of recorded webinars that cover a wide range of business topics. And you can view those at any time by clicking on demand webinars when you're on our website. Just some logistics about today's event. We have set aside time for questions and answers at the end of Sheila's presentation. If you have a question, please use the Q&A button at any time during the presentation. It's generally located on the lower part of your screen, and we'll take as many as we can up until the top of the hour. Our webinar will end sharply at 1 o'clock to respect your time. The session is being recorded, and a link to the recording will be available on our website, fairfieldcounty.score.org, within the next day or so. It's now my pleasure to introduce our speaker today, Sheila O'Donnell. As a provider representative for Anthem Blue Cross Blue Shield, Sheila educated physicians, medical staff, and patients across the state on the fundamentals of Medicare. She is currently a Medicare specialist and part of the team at Health Directions, a health insurance agency serving Fairfield County for over 2 decades. Sheila's specialty is Medicare planning, including Medicare Advantage, Medicare Supplement, and prescription drug plans. She is licensed by the state of Connecticut, certified with Medicare, and appointed with each of the major carriers. Sheila, it's all yours.
All righty. Thank you. Thank you for that nice introduction, Bob, and great to meet all of you. Thank you so much for joining me today. I recognize it is an absolutely beautiful day out there. So, if I could have, I might have played hooky. So again, thank you for, for being here. And a special thanks to Bob Hogan for organizing this event. My name, as Bob mentioned, is Sheila O'Donnell. And just in terms of my background, I have been a lifelong resident of Fairfield, so I have a lot of strong ties and connections to the greater community, and I have now been working in Medicare for over 10 years. So my what I'm hoping to accomplish today in this workshop is really just to talk about Medicare, and I'm going to share about 25 slides. I expect it to take about 35 minutes. And as Bob said, we're going to leave some time at the end for some Q&A. So please jot down your questions or add them to the chat. And, we'll certainly find a way to get all the answers to your questions. But let's start at the beginning and talk about, what is Medicare? And I laugh because oftentimes when I tell people I work in Medicare, or I just mention the word Medicare, you get the groan like, oh, Medicare. It's pretty painful. But what I want to start is by saying that Medicare is actually a really good thing, right? Because Medicare provides you a very good foundation for your health insurance coverage as you get older. And on top of that, you and or your spouse have been paying into Medicare taxes, right? That's the FICA on your pay stub. So you've been paying into Medicare for all these years, and now you're going to have the opportunity really to reap the benefits of your hard work. But at the same time, Medicare is a federal program, so it can be very kind of complex and confusing, right? You have a lot to learn. There's a lot of new terminology, rules, timelines, guidelines, penalties. Um, so the other thing I'll say is that when it comes to Medicare, when you're approaching the age of 65, right, you get inundated with all of this mail, right? You're getting mail from Medicare, you're getting all this information from the carriers. It's enough to make your head spin. So what I'm hoping to do is kind of walk you through this and share enough information so it'll take some of the confusion and the anxiety out of the equation. But the important question you have to first consider and you have to answer is should I enroll in Medicare when I turn 65? Again, you're getting all of this mail and this information. You almost feel compelled, right? You compelled to do something. You feel compelled to act. But the answer to this question is of whether should I enroll in Medicare when I turn 65, it really depends on your unique situation. So, you do need to enroll in Medicare at age 65 if you are self-employed, if your employer has less than 20 people, or your coverage is not considered credible. And when I say credible, what I mean is that your coverage has to be as good, if not better, than what original Medicare offers. So, some examples, for example, if you have coverage through a retiree plan, through the VA, through COBRA, or through the Affordable Care Act. And the Affordable Care Act is when you go onto the marketplace. For example, in Connecticut, we call it Access Health Connecticut. If you get your insurance through the ACA, you then, in this case, whether it's any retiree, veterans, COBRA, or ACA, you have to apply for Medicare at age 65 to avoid any penalties because they're not considered credible coverage. Now, generally, you can delay Medicare past age 65 without penalty if your employer has 20 or more employees or your employer health coverage is considered credible. Again, your coverage is as good, if not better, than Medicare. So, if you decide based on that criteria you're going to apply at age 65, you're going to be given what we call an initial enrollment period. It's a 7-month window, includes your birthday month, the 3 months before, and it includes the 3 months after your birthday month. And the timing of when you apply for Medicare during your initial enrollment period is very important. So if your birthday is, say, in July, you can apply 3 months before. So 7 - 3, that takes us back to March. If you apply in March, April, or May, then your coverage, I'm sorry, 7 - 3 = 4. So April, May, or June, your coverage is going to begin June 1st or July 1st. If you apply in the month, your birthday month, July, then your coverage is going to begin on 8/1, and so on and so on. So that's your initial enrollment period. If in fact you decide to enroll in Medicare at age 65. Now, many of us are working past 65 and we're thinking about retirement. Well, then you have what's called a special enrollment period, and that is an 8-month window. And it starts the last month of your employment or the last day of your health coverage, whichever comes first. And that is the period in which you can apply for Medicare Parts A and B without facing any sort of late penalty. But there are a couple other important considerations I do want to mention because these are I feel like these are the type of information that isn't always well communicated. So one thing I will say is that if you do have coverage, employer-based coverage through your spouse, you may or may not be eligible to stay on that coverage once you become eligible for Medicare. So I always say it's a really good idea to check in with your HR administrator and ask the question, as a spouse, can I continue on this coverage now that I'm eligible for Medicare, now that I am turning 65? Number two is once you enroll in Medicare, you cannot continue to contribute to an HSA. An HSA is a health savings account. They're very popular now. But again, you cannot contribute to an HSA at the same time you're eligible for Medicare. And I'll take it a step further. You actually need to discontinue your contributions and your employer contributions 6 months before you apply for Medicare. And the reason being, it's just a matter of tax implications. So that's an important consideration to keep in mind if in fact you have a health savings account with a high deductible plan. And I also want to just remind you that Medicare, these are independent, or I should say individual health plans, right? So if you have any dependents, whether it be a spouse or a child, you're going to have to think carefully about how is their coverage. How is that going to work if in fact then you enroll in Medicare? So some important things just to keep in mind. So what does Medicare cover? Well, as I said, Medicare is a provides a really great foundation, but Medicare was never intended to cover everything for you, all of your medical needs. So let's look. So Medicare, this is the typical Medicare ID card, member ID card. It breaks down the services into Part A, hospital, and Part B, medical. So if we look at Part A, in general terms, that's the care that you receive anytime you're admitted to the hospital, a skilled nursing facility, or a hospice. And the good news is there's no premium for Part A. And just to give you a more specific idea, if you're admitted to the hospital, then the cost of your room, your meals, all of your nursing care, as well as any supplies or prescriptions that are that are administered to you while you're in the hospital, all of that's going to fall under Part A. Now, Part B, this is your medical insurance, right? So, in general terms, these are the services that you receive outside of the hospital walls. And the Medicare Part B um, is also going to include services such as preventive services, outpatient surgery, home health care, durable medical equipment, plus all doctor services, whether you see the doctor in the hospital or you see him outside of the hospital, the doctor services are going to always fall under Part B. Now, there is a Part B premium, which is based on what we call IRMA. And IRMA stands for Income Related Modified Adjusted Amount. And without getting into too much detail, what they do is they do a 2-year look back. So Medicare is going to look at how you filed your taxes 2 years ago, whether you did it as an individual or as a couple. And then based on your income, you are going to pay a Part B premium in the range of anywhere from 185 to 628. The great majority of all of us fall into the first income bracket, so most of us pay 185. But it's important to know it can be higher based on your income. Okay. Now, as I said, Medicare doesn't cover everything. So what are some of the services that Medicare is not going to provide to you? It's not going to cover all the cost of your care, and we're going to dive into that a little more deeply in a minute. Medicare does not cover your prescription drugs, any routine dental, vision, or hearing. Medicare is not going to cover the cost of any eyeglasses, contacts, or hearing aids long term, right? So long term is very different than skilled nursing. Long term is where you go for that custodial type care, right? Whereas skilled nursing is you've had an injury, you've had a fall, you've had surgery. Skilled nursing is where you go for rehabilitation. Long term care is where you go and it's truly a nursing home. That's not no there's Medicare isn't going to cover any costs associated with a nursing home for long-term care. Excess charges, we can kind of skip that. We don't Connecticut doesn't allow for excess charges to by doctors in Connecticut, so we don't have to worry about that. And then lastly, Medicare typically isn't going to cover any kind of emergency care outside of the United States. So not only does Medicare not, it doesn't cover all services, but Medicare, some people seem to think, oh, or think that Medicare is free. Well, it's actually not free. And with Medicare, there are a lot of cost shares. And by cost shares, I mean there are premiums, deductibles, right? Deductibles would be the amount that you need to pay or meet before the plan would begin to pay anything. There are copays that you're responsible for, as well as coinsurance. Copays are usually a fixed amount, whereas coinsurance typically is a percentage. So let's look a little bit more closely at the costs of Medicare. On the left-hand side here, we have Part A, hospital care. There's no premium, right? For most of us, as I said, for Part A. However, if you're admitted to the hospital, you do have a deductible of $16.76. You have to reach that deductible, pay for the services towards that deductible before original Medicare is going to pay anything. Additionally, original Medicare will pay for the first 60 days that you're in the hospital. But from day 61 to 90, you're going to pay a daily copay of $408. And then after 91 days, you would be paying a daily copay of $816. Now, the reality is not many of us, right? No one really stays in the hospital for very long. But God forbid you're in a terrible accident or you have, a really difficult diagnosis and you're in and out of the hospital, extended stays. That's where this could be problematic. Skilled nursing, again, original Medicare, they're going to pay the first 20 days. But after that, you're going to pay a copay each day of $209.50. Now we jump to the Part B side. I mentioned the standard premium is $185 for most of us. Some people are going to pay a little bit more based on premium, or I should say a lot more based on their income. You also have a deductible for Part B services. So you meet that 257 and then Medicare will start paying for your Part B. And then lastly, you have a 20% coinsurance, which means Medicare is going to pay 80% of the cost of your Part B, but you're going to pay 20%. And there's no max out of pocket. So when I look at this, what it says to me is that the there is a lot of financial risk here if you only have original Medicare, right? There are a lot of costs here, particularly this 20%. And I'll just share one example. If you have a diagnosis such as cancer, a typical, or I should say, the typical protocol would be rounds of chemotherapy, radiation. Well, you are going to pay 20% of that treatment because that falls under Part B. So my point is the numbers, the financial risk can be significant if you have a difficult medical picture. So based on the fact that Medicare doesn't cover all your medical needs, and given that Medicare does have a lot of cost shares, excuse me, the next question is, well, where can I get more coverage, right? Well, the good news is we have two options. Let's talk about on the left-hand side first here. In this case, you can keep original Medicare Parts A and B as your primary insurance. They're going to pay first. Medicare requires that you have a prescription drug plan, and you have to get that through a private insurance company. Whether or not you're taking any prescriptions, you are required by Medicare to have a prescription drug plan. We call it a standalone prescription drug plan in this case. And then the last piece is you add a Medicare supplement as your secondary insurance. And we're going to just focus on that Medicare supplement and see exactly how that works. And then we're going to come back to Medicare Advantage. So Medicare supplement, right? Original Medicare, I said, is your primary. The Medicare supplement is your secondary insurance. You are going to pay a premium, a monthly premium for Medicare supplement. It's anywhere from $200 a month to $260, depending on the plan. Now the benefits are standardized, which means that a plan with the same letter must offer exactly the same benefits. In other words, a Plan G is a Plan G is a Plan G, regardless of whether it's a Connecticut Plan G, a Unite Healthcare Plan G, or a Humana. The coverage is exactly the same. The one difference is are the premiums, though. And then the last difference is, or I should say, the last thing to know about a Medicare supplement is how does it work? Well, it covers the Medicare gaps in care. Let's take a look at that. So we're going back to this diagram, right? We have Part A on the left, we have Part B in the medical, Part B medical in the middle. And these are all the gaps we call. These are the costs, the gaps in costs. So let's say you're enrolled in a Medicare Supplement Plan G. You meet the deductible here of 257. You can see that right here. You meet this deductible. Once you meet that deductible, then the Medicare supplement picks up all of these costs, right? So essentially, you're taking all of the financial risk and you're transferring it to the insurance company. So that's really how that's the important element of how med sup work, right? Original Medicare is going to pay primary for your meds at the hospital, right? So the hospital is going to send that bill to original Medicare. And then any balance in the way of all these cost shares, that balance, that bill is going to be sent right to the Medicare supplement company. And they're going to pick up those costs. So you pay your premium and pretty much all the other costs go away. There's also some other really great benefits to a Medicare supplement. You have no network to worry about, no HMO, no PPO. You can go to any doctor, any hospital, any facility that accepts Medicare anywhere in the country. You don't need to get referrals. No pre-authorizations ever needed. As long as if your doctor recommends a hip surgery or any kind of knee surgery, whatever you might need, as long as it's covered by original Medicare, there's no further discussion. It is a lifetime policy, so once you're enrolled in Medicare supplement, you can never be denied coverage, and it's portable. As I said, given that there's no network, it'll work for you anywhere in the United States, provided the physician accepts Medicare, which 99% of physicians accept Medicare. The exception would be like obviously pediatricians. Um, I'm finding more and more psychiatrists and gynecologists do not accept Medicare. Okay, so let's go back to our options. We covered the left-hand side, the original Medicare and Medicare supplement. Now we're going to jump over here to the right-hand side, the Medicare Advantage plan. And this is also often referred to as Part C. Now, what I will say is this is very different than a Medicare supplement. It's kind of like comparing apples to oranges. So let's take a closer look at the Medicare Advantage plan. So the Medicare Advantage plan, it's 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 wonderful in that there's no monthly premium, right? So that really works well for a lot of us in terms of our budget. And the Medicare Advantage combines your medical, I should say your Part A, your Part B, and your Part D. D is the drugs, all under one umbrella, right? So everything is all under the one plan. And with the Medicare Advantage, you're not paying a premium, but you do have copays and coinsurance as you go along. So let's look at some of the typical copays. If you're generally healthy, a Medicare Advantage can be a great option. And I'll show you why. So your primary care visits and any preventive type care screenings, that's all going to be covered at 100%. So it's and they really encourage you, right, in terms of getting all of that primary preventive care. The point of the Medicare Advantage is to keep you healthy and to kind of stay ahead of any type of medical care or medical issues that might arise. So when it comes to mammograms, colonoscopies, bone mass density, those are having to do with any kind of cholesterol screenings, hypertension, all of that's covered at 100%. If you go to a specialist, you're going to pay a copay of $45 typically. If you require a CAT scan, right? 215 copay. Urgent care, it's the weekend and you say, "Oh, I got to get in to see someone." You're going to pay a copay of 40. Emergency care, copay of 120. This probably sounds kind of, hopefully, um, similar to maybe your employer plan, right? Where you are going to go ahead and you're going to be paying copays as you go. Outpatient surgery, gosh, so many of my clients, it just seems everyone, when we get to this age and we need a knee replacement or hip surgery or an elbow or wrist, what have you. So that outpatient surgery, your copay would be 395. The way the inpatient hospital works is typically you pay a copay of, say, for this is 395, say for days 1 through 5. After that, after day 5, the Medicare Advantage plan picks up all of the costs. Similarly, if you're admitted to a skilled nursing facility, excuse me, the Medicare Advantage is going to cover the first 20 days at 100%, but you're going to have a daily copay from day 21 on of 203 per day. I'll also mention that unlike original Medicare, remember when I said Part B, I said there's no max out of pocket, right? So it really puts you at tremendous financial risk. Whereas with a Medicare Advantage plan, they have what's called an annual out of pocket max. Sometimes what we call it a MOOP, maximum out of pocket. So in this case, if you were paying copays and coinsurance, and you spent $6,700 out of your own pocket, then the Medicare Advantage would pay all the costs for the remainder of the year. This is sort of the worst case scenario. I've yet to have a client who has reached their max out of pocket, thank goodness. But my point is, at least you are protected. There is a ceiling. Then come January 1st, the clock resets. The nice thing about the Medicare Advantage is that it offers some very extra, what we call them, supplemental benefits. They're sort of these extra nice benefits that you get. So the Medicare Advantage, right, is going to offer or is going to provide some dental, vision, and hearing benefits, which original Medicare does not offer any of that. So in this case, the Medicare Advantage kind of gives you everything the original Medicare does, and then they add on some of these extra benefits. Some of them offer, all of them offer some sort of fitness program, which is a really nice benefit. So then the question becomes, well, how do I choose, right? How do I choose if I should get a Medicare supplement or what we call MediSup, or should I get a Medicare Advantage? And let's just make the comparison and just get an idea of, how are they different? Because I think it's important to consider that they're very different. We're comparing apples to oranges here. So it's important to think about your unique situation. So here we have Medicare Advantage or Medicare Supplement. And I'll just point out the things that jump out at me. The left hand side is our Medicare Advantage, and on the right hand side is the Medicare Supplement plan. This is probably one of the most important ones. With the Medicare Advantage, you do have to stay within the network, whether it be an HMO or a PPO. Whereas with a Medicare supplement, as I said, you can go to any doctor that accepts Medicare. So you have lots of flexibility. And Medicare is going to require pre-authorizations for many services. It doesn't impact you very much. It does create some extra work for the physicians, right? Their office is the one that has to fill out the pre-authorization forms and get them processed, et cetera. But typically things do get authorized. But sometimes I will say, I'll share an example. Someone, their ortho had suggested that she have a full hip replacement. And when they submitted the pre-authorization, the insurance company, the Medicare Advantage company said, well, we would like you to first try a period of 3 or 6 months of physical therapy. And then let's see, we'll make a decision at that point. With the Medicare supplement, they don't require, a Medicare supplement does not require pre-authorizations. The Medicare Advantage, as I said, offers those extra benefits, the dental, the vision, the hearing. Sometimes they offer over the counter. Almost all offer a free fitness membership to whether it be the Fitness Edge or Planet Fitness, what have you. Whereas a Medicare supplement isn't going to offer you anything in terms of preventive dental, vision, and hearing. Now, what a Medicare supplement will cover, because Medicare will cover, is diseases, say of the eye or the of the ear. So let's say you have glaucoma, macular degeneration, cataracts. Medicare will cover the disease of the eye and will absolutely cover your care. Same thing. Let's say with hearing, you have something like Meniere's. You're diagnosed with Meniere's. It's a disease of the ear. Well, Medicare will absolutely cover that cost. But what they're not going to cover is that routine dental, vision, and hearing. So just an important distinction. Medicare Advantage, you can make changes only at certain times of the year, whereas with a Medicare supplement, you can make changes from one carrier, one insurance company to another. You can switch from Plan G to Plan N. There's really no restriction. The other thing I'll mention, which is important, is Connecticut is a guaranteed issue state. It's one of 5 in the country. So why is that important? Well, let's say, like many of my clients, they'll say, "Well, I think I'm gonna start with the Medicare Advantage. I'm in good health now." And then at a later date, they'll say to me, "Can I change? Can I switch over to a Medicare supplement?" And because we have guaranteed issue, meaning there's no medical review, they can't deny you based on pre-existing conditions or, you know, um, maybe certain medications that you're taking. So therefore, you have a lot more flexibility living in Connecticut, right? You always have the option to start with the Medicare Advantage and then transition to a Medicare supplement if it's appropriate. One thing I'll say in terms of costs with the Medicare Advantage, the good news is there's no premium, but you're going to pay as you go, right? So that's the difference. Whereas a Medicare supplement, you're going to pay your premium and then the co-pays, the co-insurance, all those extra costs go away. So with the Medicare supplement, your costs are more fixed and predictable. And then lastly, the Medicare Advantage does include prescription drug coverage, right? It's embedded in the plan. Whereas with the Medicare supplement, as I said earlier, you need to add a standalone prescription drug coverage. But what I'll say is this is where I I tend to be a really good resource for folks because we kind of look at this together. We compare the Medicare Advantage, the Medicare supplement. We look at your doctors. We look at your medications, right? And we sort of collaborate and come up with a what we think is the best option based on what we know today. And also knowing that you can make a change in Connecticut at a later time if you need to. Um, a couple things I will say, sort of as I wrap up here, is some of the questions you want to think about when considering whether to get a Medicare Advantage or a Medicare supplement. Think about your budget. Are you more comfortable with the $0 premium, or are you would you be able to pay a monthly premium for a Medicare supplement? Do you need to keep all of your doctors, or do you like the flexibility to go to whichever doctor you want to see? Um, do you travel frequently? So, for people who are snowbirds and they spend part of the year here and then they're in Florida for a few months of the year or in the Carolinas, well, that's something to think about. That should influence your decision. And then the last piece is also the medications, the prescriptions, right? And we talk through that and we just decide which plan makes the most sense for you, which plan is going to work best for you, based on your budget, your doctors, and your medications, right? Because we want to select a plan that's going to be a really good fit and serve you well. And then lastly, where I can go for help, well, I want to share here's a couple of websites that can be very helpful. You have medicare.gov, And then if you look up the website for Medicare Right Center, there's a lot of information there, right? So I would suggest that you certainly could look at those resources. And I'm one of those people, I like to print those things out, and then I highlight and I fold pages and I jot down questions. But I want you to know that I'm more than happy to be a resource for you as well. And I will reiterate, there's absolutely no cost for my time or expertise. But if I can help you with the process of applying for Medicare, if I can help you select a Medicare based plan, I would be happy to help you, to offer any kind of guidance along the way. So, I say to people, make me your go-to resource. Don't ever hesitate to pick up the phone or email me, and whether it's a small question or what you think is a silly question or it's something more complicated, don't hesitate to reach out. That's what I do all day long. And I think that should do it. If we have some questions that I could answer.
We do. Thanks so much, Sheila. We're going to use the remaining time for questions and answers, and we have a number of questions. But just a reminder, contrary to my original instruction in the chat, please put your questions in the Q&A section. It just makes it easier for us to have them in one place. And we'll start with a question from Ginny, who's saying, at some point, I'd like to know if the recent pink USPS postcard form I received is legit or a solicitation. It's titled 2025 Medicare Supplement Comparison Schedule for Americans turning age 65. Says it's a registered document, do not destroy, and has my name and address pre-filled and printed on it. So can you
Hmm.
shed any light on that type of postcard there, Sheila?
Well, what I would say is when it comes to marketing these plans, they can be pretty good at it, right? And it can be hard to tell sometimes what is something that has been sent by Medicare versus what is something that is a marketing piece. I will say when it comes to the Medicare supplements, I always depend on the resources that are either government subsidies or government agencies and that type of thing. So I just would be very careful about anything that you receive in the mail, because more often than not, there's a very good chance that it is something that has been sent as a marketing tool. So I guess I would say, just be careful about the information that you're taking in, and you can always reach out to me, because I do have a legit website where I go to for information specific to Medicare supplement plans and what the current rates are in Connecticut. So yes,
I would agree with that. It's likely a good chance that it's marketing related.
yeah.
Uh, Our next question is from Londa, and her question is, do I need to keep my retirement insurance?
Well, what I would say is, typically, retirement insurance is a really wonderful benefit. You would have to enroll in Medicare Parts A and B, so you would have to pay for that Part B premium in addition to whatever you might be paying for your retiree coverage. Now, some people like to do the analysis and compare their retiree coverage to a Medicare-based plan. And that's certainly something I could help you with, and we can kind of take a look at them and compare them side by side. But I always say to people, you have to be very careful, um, because if you disenroll, say, from an employer plan or from a retiree plan, you may not be able to ever get it back. So you have to be very careful and very thoughtful before you make a transition to Medicare, that you know what you're doing and it makes good sense in terms of your budget and your healthcare needs. So again, I would just be very cautious about making a change.
Um, we had a couple from Tony. Tony was asking, what is Medigap? Is that Advantage or Supplement? And he was also asking what PPO was, which is Preferred Provider Organization. So maybe you just answer the one on the Medigap.
Yeah, sure. So what I'll say is a Medicare supplement. It's kind of it's a mouthful. So oftentimes I find myself referring to it as a med sup or a Medigap. They're all exactly, it's this different terms for the same exact plan. Medicare Supplement is a Med Sup or Medi Gap. They call it a Medi Gap because the Medicare supplements cover the cost gaps. So hopefully that makes sense. But great question. And then PPO, you mentioned, Bob, what I'll say about a PPO versus an HMO, very different. An HMO, the way I remember is HMO, the letters are similar to the word home, right? So typically your HMO tends to be, your service area is going to be, say, the state of Connecticut, right? And it's more restrictive. A PPO, for example, United Healthcare has a PPO. Well, that's a national PPO. So you can go to any provider that's in that PPO network anywhere in the country, right? So it allows you more flexibility. Also with the PPO, you can go in the network, which is best, but you can go out of the network if you want to see a provider that's not in the network. So your cost shares would be higher if you go out of network. But again, that flexibility, it's nice to have. Particularly if you want to go and get a second opinion or you want to see a specialist in Boston. It's nice to have a little bit of flexibility, but either one, they can work for you depending on what your needs are.
Okay, that's great. Um, we have another question from Ginny, who's asking, how often do the premiums, copays change, and what kind of notice is given?
Yep. Okay. So when we're talking about a Medicare Advantage, they are annual contracts, right? So they run from January 1st to December 31st. So the way it works is typically you're notified in early, like September, October. If, for example, if you're enrolled in a Medicare Advantage, and the insurance company, is required to send you what's called an ANOC, annual notice of change. So they're going to tell you what are the changes in your Medicare Advantage plan for the upcoming year. They have to give you that information. And sometimes there's not much of a change, and sometimes this year we had a lot of changes. So it kind of depends. Now, what I always do with my clients is I let them know ahead of time. I usually get an early peek. And if I see, gosh, they're making a lot of changes to XYZ plan, I'm going to reach out to my clients who had that plan and say, hey, there may be a better option, or I'm concerned about this. So it's just important to be able to have that conversation with someone just to understand what are the changes, how are they going to impact you, and is there a better option available for you? And that's why we have annual enrollment every year, starting October 15th to December 7th. That's when you make a change if you want to. And then your new plan would begin January 1st. Now, Medicare Supplement, those benefits, the coverage doesn't change. But what will change is the premiums. And Medicare supplements, they run from June 1st to May 31st. So typically, if they're going to have a premium change, not always, but usually it will happen sometime in the spring. And then it would go into effect usually June 1st.
That's great, very helpful. Couple of questions on international. Tony asking, just confirming that Medicare does not cover emergency coverage abroad. And also, when people are on Medicare, when they're traveling internationally or out of state, do people typically purchase some kind of temporary insurance when they're going out of the country?
Yeah, no, these are all great questions, everybody. You guys are, and good questions are always a sign of, if you're asking the right questions, you're on the right path. What I will say is, many of the Medicare supplement plans do offer some emergency coverage worldwide. And I want to say there's a deductible you have to meet, and then there is like a $50,000 lifetime benefit for emergency care outside the country. So my point is original Medicare won't offer you any kind of emergency coverage out of the country, whereas the Medicare supplement, they do. And I could talk to you a little bit more in detail one-on-one because it depends on the carrier. Yeah, what is the type of coverage? How does it work? What are your costs, that sort of thing. But there is some offered with almost, I would say, most of the Medicare supplement companies.
Okay, that's great, very helpful. Here's one from Susan. Do the plans work the same in New York versus Connecticut?
No, no. It's so for example, I'm licensed in Connecticut and I can only enroll people who live in Connecticut, right? That's how they decide. They're they're going to look at your primary residence, and the way they're going to confirm that is however you file your taxes. So you have to live within the state that you enroll in the plan. And then, if you spend part of your time in New York, that's fine, because with a Medicare Advantage plan, for example, you're always going to be covered for emergency care, even if you're outside of your service area. But yes, the plans are very different from Connecticut to New York. They can be very, very different in terms of the benefits, the network, et cetera.
This is a follow-up question from one that Londa gave earlier. If I keep my retirement insurance, do I need Medicare Advantage or the supplement?
Well, you wouldn't know what if you're going to keep your retiree plan, you would just want to enroll in original Medicare Parts A and B, and then you would have your retiree coverage. Now, if you wanted to compare how your retiree coverage compares to, say, a Medicare Advantage or a Medicare Supplement, you could do that, but it would be one or the other. You wouldn't want to have retiree coverage and then also have a Medicare Advantage or Medicare Supplement in addition. But as I said, you have to enroll in Medicare Parts A and B if you're going to continue with that retiree coverage to avoid. Well, the main issue is there's a penalty, but also it's a coordination of benefits. That's the important piece. So in your case, if something were to happen, you're in that retiree plan, Medicare would be your primary. So Medicare would pay first, and then the retiree plan would pay second. But if you don't have Medicare Parts A and B, excuse me, then you would be responsible. You would be the primary payer. So that's why it's really important to make sure that you have that you have that done. That everything is in place in terms of Medicare A and B and your retiree plan.
Our next one, I think, is maybe more of a comment than a question, but and it's from Michael. But I'll just read it, and maybe you can address some of the concerns. Michael is saying, given that the biz model for Advantage is to create a profit by denying coverage, which is why multiple elected reps have tried to end the program, forbid its use of the name Medicare. Are you going to warn people that the perks are great as long as your coverage is not denied?
Yeah, and I talked about that in the comparison chart, right? It said right there 70% of services require pre-authorization with Medicare Advantage plans. And whereas a Medicare supplement, the insurance company never enters the equation. As long as it's covered by Medicare, the Medicare supplement is going to cover any of the cost shares. But what I will say when it comes to prior authorization, I think it's a great question, right? Because particularly the tragedy with United Healthcare, and there's a lot of discussion about these prior authorizations. And in my experience over 10 years, um, yes, I would say definitely the insurance, Medicare Advantage, they are going to require these prior authorizations. And I will say there have been a couple instances where I've had to get involved myself because the client is waiting for surgery. They still haven't gotten the prior authorization. Then I'm reaching out to my contact at the insurance company saying, we need to get some resolution. We need to move this along, right? So I really try to advocate well for my clients. But I would say there are some people, or a lot of people, that would say the Medicare Advantage has gotten sort of a bad name because of these prior authorizations. But I think, in large part, I have not had a client negatively impacted in over 10 years. That's the positive. Even if they were told, well, we want you to do physical therapy before, we would approve this. Sometimes they are going to make you jump through hoops. I'll give you an example. I was in the hospital in the fall. I had a bicycle accident. So I was in the emergency room. I then spent the night in the hospital. The bill was $13,000. Now, initially, my insurance company kind of, balked and said, well, wait a minute. We're not sure if we're going to cover this. So I had to jump through a couple of hoops. And yes, were all the costs picked up in terms of my hospital admission? Absolutely. But my point is, I just feel that the Medicare Advantage companies are trying to contain costs, but they also have to, um, they owe it to their members to provide good coverage especially when it's needed most. So I think that's an ongoing debate. I think that there's always room for improvement, but I feel in my experience over the last 10 years with lots of clients, knock on wood, that has not been an issue. But if it's something that you're not comfortable with, and I would understand why, then I think a Medicare supplement probably makes a lot more sense for someone like that, right? Because now there is no network, right? You're not there is no prior authorization. You have tons of flexibility. But along with that, there's a higher a $200 to $260 premium. Not all of us can afford that or want to afford that at this point in our life. And the Medicare Advantage, I will say, if you're generally healthy, can serve you very, very well. But we have no crystal ball, right? So insurance is always about making the best decisions that we can at this time. And then what I always say to my clients is, and then when there is a change in your medical status or your age, what have you, then we work together and we decide, okay, where should we go now? What's the best coverage for you now? Maybe it's not the same that it was 5 years ago. So that's where I try to always continue to be an advocate and collaborate with my clients. I hope I
Um,
answered your question. I'm sorry. It's something, we could
yeah,
talk 3 hours about. So reach out
very
to
good.
me one on one if you want to chat about it. But I understand your concerns. I do.
Great. Yeah, we've got a couple minutes left, so we'll take a few more. Here's one from Derek. It's it says, I have Aetna Choice and Medicaid. However, Social Security deducts the premium and they are taking out double. Should I get a lawyer to contest it?
Tell me that again. So what is coming out of your Social Security?
He says, I have Aetna Choice and Medicaid. However, Social Security deducts the premium and they are taking out double.
The premium for your Part B?
That's all we have. I think he's Aetna Choice and Medicaid. So I don't have any more details.
Hmm. So typically the way it works, if you're receiving Social Security benefits, um, then what they will do is they will the Part B premium, that standard 185 that I spoke about, that is automatically withdrawn from your Social Security benefits. But in terms of the Aetna Choice, that doesn't add up to me. They're they should never they would never withdraw the cost of the premium from your Social Security for private insurance, and then Medicaid there would be no premium. So I would just say if you're available and you want to talk one on one, maybe if I could ask you a few questions, I could understand better what you're saying.
Yeah, no, I agree. It's not quite enough detail there. Here's one. Here's a question. If my birthday is in June and I maxed out my HSA in March, did I meet the guidelines given I'm going on Medicare in June? So
Okay,
maxed
so
out the HSA a few months before they turned 65.
March, April, May. So it looks like you discontinued it 3 months before, is what I'm guessing. What they ask is that you stop your contribution 6 months before. So what I would say is now we're talking about 3 months, right? Because if you didn't, if you hadn't, if we're looking for June, I'm just going back to March. Let's say even July, your coverage would end um, at the end of June. So July 1st. So now you're talking 4 months. My point is, if there is what I would do is I would suggest you do nothing at this point. I wouldn't call Social Security. I wouldn't raise any red flags. If they uncover it, fine. It's actually it's nominal. What the tax would be. They're going to look at your contribution to your HSA. They're going to look at the interest earned for that 3 month period or whatever. And then you may or may not be hit with a tax penalty, but it tends to be quite small unless you are making unusually large contributions to your HSA. So my short answer is I wouldn't worry about it. I wouldn't raise any red flags, and there's a possibility it may go away, or you may have some additional taxes to just pay, but it would be pretty insignificant based on what you're telling me.
Okay, thank you. Let me see here. What do we got here? Here's one from Russell. As I plan to continue working for several more years, do I have to sign up for Medicare if I still have my plan through through my employer? I just turned 65.
Yeah, no, that's where most of us fall into that bucket, right? We're over 65 and we're continuing to work. The only thing I would ask you is just you want to confirm it's credible coverage. And as long as there are 20 or more employees on the payroll, they don't even have to be on the insurance plan, but there are 20 or more people on the payroll, then you should be absolutely fine and you don't have to worry about doing anything until closer to retirement. And typically, what I say is you want to start that process 3 or 4 months before your retirement date. And there are specific steps you need to take and reach out anytime. And I can share with you the step by step instructions and the links for applying for Medicare Parts A and B using, in your case, that special election period.
Here's one. Can something like an MRI test order by my doctor be denied by my Connecticut insurance did? And what is the appeal process?
Um, well, again, if it's for a Medicare based plan, um, there is going to be a specific appeal process. Um, and yeah, it's hard because every plan does it a little bit differently. Um, but yes, there is an opportunity. It's a matter of filling out a form. There may be some documentation, what have you. It's a little bit hard for me to talk about like a specific situation. If you want to reach out and talk to me individually, I could give you some guidance, and I would have the forms for Aetna, provided it's a Medicare based plan that you're speaking of, that you're enrolled in. If it's an employer plan, that's a little bit different. So if I can help you, email me, and we can chat by phone.
And we'll just end up on a couple of clarifications. There's one asking for clarification. Did you say that that both Medicare Supplement and Advantage provide coverage when overseas? I think the answer was no, neither of them do, correct?
The Medicare supplement, yes, the Medicare supplement plans, not all of them, but they most of them do provide some emergency coverage when you're outside of the United States. I will say though, without question, for anyone who is traveling, whether it's in the United States or out, it's always a good idea to get additional travel insurance. Um, and I've seen that firsthand. Someone I knew went on a cruise, they get off the cruise in Italy and they trip off a curb and they have a broken leg. They had travel insurance and it really was a saving grace. The other thing I'll mention, when a Medicare Advantage, you absolutely have emergency care within the United States, which is just very, very important. Because if there's any time you're in a situation where your life or your health is in danger, absolutely you want to call the ambulance. You want to get to the hospital because you will be covered for emergency care with any Medicare Advantage plan or Medicare supplement within the US.
And just the last one, Marissa is asking for just clarification. Can you repeat the Connecticut law that allows participants to switch from an Advantage plan to a supplement plan without a physical
Yeah.
exam?
Yeah, no, that's a great point. So what it's called is called guaranteed issue. And there are 5 states in the country. We have New York, Connecticut, Massachusetts, Maine, and Vermont. Those are the 5 states that have guaranteed issue. And what that means is that there is no medical underwriting. There's no medical review, meaning the insurance company is never going to look at your medical records. They're not going to consider what prescriptions you're taking. You cannot be denied based on any kind of pre-existing condition. And that's why at any point um, you can make a switch from a Medicare Advantage to a Medicare supplement. They can never take into to consideration your age, your health. I mean, we're very fortunate in that regard. Now, I have a lot of clients whose parents moved to Florida. The parents were on a Medicare Advantage. Now they are much older and they would be much better served with a Medicare supplement, right? They're going to specialists a lot. They're in and out of the hospital. They cannot get accepted into a Medicare supplement plan because they're too high risk. So they're not going, no insurance company is going to take on someone that's high risk in that case. But in Connecticut, in Connecticut, and this has been longstanding, it is a guaranteed issue state. So in Connecticut, you would have the option to switch from a Medicare Advantage to a Medicare Supplement. Now, there are times we have to say, well, you're going to have to pick up a standalone prescription drug plan. So it is possible that we would have to pivot and say, okay, well, when annual enrollment comes up, then we can enroll you in a prescription drug plan. But let me just share one last important thing regarding the guaranteed issue. The other thing about if you are in a Medicare Advantage plan, you get a 12-month trial right. That's when you first become eligible, or I should say when your Medicare Part A and B become activated. The clock starts then. You have 12 months. If you are in a Medicare Advantage plan, at any point during those 12 months, if you decide you want to go back to original Medicare and add a Medicare supplement, you absolutely can do that at any time during the first 12 months that you are new to Medicare Parts A and B. So that's a nice opportunity to sort of, how should I say, give the Medicare Advantage plan a try, and then you can make a change if need be.
Great. Unfortunately, we are out of time, so that's all the time we have questions for today. Just as a reminder, a recording of the webinar is available, and the materials will be available on our website within the next day or so under recorded webinars. And our next live webinar will be tomorrow, Wednesday, May 21st at noon, when Cliff Anico will be presenting Selling on Amazon and other platforms. Look for the specifics on our website. And also, for those of you who are in Fairfield County, we also have an in-person workshop tomorrow evening starting at 6 p.m. on entrepreneurial basics, what you need to know, and that'll be held at the Wilton Library. And again, SCORE offers free individual counseling, and if you want to take advantage of that, you can use the link that we showed earlier, or you can go to our website and click on the Request a Mentor button. We'd really appreciate it if you could fill out your evaluations that are sent at the end of the webinar. They're very helpful to us. And on behalf of SCORE, I'd like to thank everyone for attending today's live webinar. And in closing, a big special thank you to Sheila for all the great information and the question and answer period today. We really appreciate it. Thanks, Sheila. Enjoy the rest of your day.
Thank you, everyone. You were a great group. I love the questions. Thank you so much.
Thank you.
Be well.